So this is going to be a wonderful session. Let's all keep um let's keep let's stay on the call and enjoy this wonderful session. Thank you so much, Elizabeth. You can take over.
All right, thank you so much. Good morning, everyone. So, just as he stated, my name is Elizabeth. I'm a management system consultant with Transformation College, and I specialize in quality management system and occupational health and safety system and other ISO standards as well. So today we are going to briefly talk about ISO 45001, which is occupational health and safety management system. All right, so before we proceed, I would like to share my screen and then we can take over from there. So kindly give me a minute so that I can project my screen and then we can start with today's session. Thank you so much. All right. So kindly confirm if you can see my screen and then we can go on from there.
Yes, we can see your screen.
All right, thank you so much. So, just as I proceeded earlier, today's session is about occupational health and safety management system. That is the ISO 45001 2018 version. All right. So, that is the course we are about to have today. So, what are our learning objectives? Why are we here, right? Is for us to understand the fundamentals of 45001, is to grasp key concepts and principles of the management system, and to familiarize ourselves with what the requirement of 45001 2018 says. Another is to develop skills for implementing the OHS. And if you are an organization and you want to prepare for OHS certification, this is the right class for you. Its learning objective is to prepare the company for certification and to drive continual improvement. So let us proceed. But before we do that, we need to also understand what ISO is, right? ISO is International Organization of Standardization. If you are trying to abbreviate it, you see you get IOS, not ISO, right? So the ISO was from a French word, right? But when you translate that French word to English, you get International Organization of Standardization. And this was founded in 1947, and it has its headquarters in Switzerland, right? And what we say ISO, what is this ISO? Right? It's an independent, non-governmental international organization that develops and publishes standards to ensure quality, safety, efficiency, and consistency across various industries. So the goal of ISO is to make sure that people are using one uniform standard or requirement of the standard to ensure quality, safety, efficiency, and consistency, right? So it's not here that maybe someone is using one standard to do something, another company is using, but it's uniform. And it comprises of 168 national standard bodies. All right. So, what is the objective of the ISO? Is to foster global trade by harmonizing international standard, right? So you not get different standard, but you harmonize all the international standard. Is to improve safety, security, and environmental protection through standardization, and is to provide organization with tools to improve performance and efficiency. So after that, we have looked at what ISO is. We will then look at what we want to speak on today, right? That is the occupational health and safety management system. And we need to look at what it is, what it entails, and everything, right? So the OHS is a structured framework designed to manage workplace health and safety risks effectively, right? So it's a framework that is used by organizations to make sure that they are managing their workplace health and safety risk. And it ensures that the organization proactively identify, assess, and control hazard to protect workers and other stakeholders from harm. So in here, the keywords are not just identify, but once you identify what your workplace hazards are, you have to assess it and make sure that you are putting in controls to mitigate those hazards, right? So the OHS is not a framework just to manage workplace health and safety risk, but is to make sure that it is used to assess it and put in controls. So the ISO 45001 provides a global standard for OHSMS, that is Occupational Health and Safety Management System, offering organizations a systematic approach to improving occupational health and safety performance. So once we have looked at the overview, we need to look at the key features of what the OHS is. So it involves risk management. So just as I stated, that the risk management in here is not just identifying, but assessing and mitigating, putting in controls to make sure that all OHS risks are mitigated. It also entails worker participation. So make sure that employees or most employees are engaged in the safety decision-making process. It also entails legal compliance, right? So when you have the OHS, make sure that you adhere to regulatory and statutory obligations. It also entails continuous improvement. So you having the management system or you having the OHS doesn't limit it. Make sure you put in continuous effort to improve upon, and then it doesn't limit it to just the ISO 45001. You can integrate it with other management systems like the 9001, that is quality management system, as well as 14,001, that is for environment. So you can integrate your occupational health and safety with both your quality management system as well as your environment, right? So you managing how your product or services are quality, and also managing your environment. You can add occupational health and safety management, which will protect your employees as well as other stakeholders. So you can integrate all these three standards together. All right. So what is the core element of the OHS? What does it entail? Right? It entails policy development. So you have to make sure that you establish a health and safety policy that states that, okay, this company is committed to ensuring that its workers are protected from health and safety risk. And it doesn't stop from there. The policy gives out a guideline of what you need to do. So you have to make sure that you have a policy in place when you have an OHS, right? You have to also make sure that you set objectives. So they are planning, you have to plan for your objectives. You have to also identify risks and opportunities. It doesn't end there, right? Another core element of the OHS is support, ensuring resources, competence, and awareness. So once you have an OHS, you have to make sure that you have resources in place. You have resources in place. You have resources in place. And the resources here is not just talking about money or budgets, but resources like people resource. The resources here is not talking about just budget or having a monetary budget for OHS, as in buying of PPEs, making sure that you have fire extinguishers, making sure that you have evacuation plan in your company, but making sure that you have people in charge of managing the OHS. We have tools. So the tools is where the evacuation plan comes in, right? You have fire extinguishers, all this summarize and comes up with and make the resource. You have to make sure that the people you are putting in charge are competent. So you provide trainings for them. Right. And you are going to make sure that the whole organization is aware of the health and safety practices. So if you have practices in place, you have to make sure that people are aware so that they know that, okay, my organization is trying to bring upon or bring on board the OHS. Right. So it doesn't just limit it doesn't really limit it as in setting up a policy, right? Or planning objectives or identify risks and opportunities. There has to be resources for that objective to come into being or for that objective to be realized, right? And we have operations. One key element is operations. So you have set your objective, you have established your safety policy, you have made sure that people are in charge. You have done competence. You have given them trainings so that they'll be competent enough in managing the OHS. You have given them awareness. One thing you have to do is also implement controls. So you have identified one risk as fire risks. So you have realized that your company is at risk of fire. You have to put in controls. One control is making sure that there's fire extinguisher. So it just doesn't limit it to just planning of your risks, planning of your opportunities, setting up objectives. Once you have done that and you have the resources to do it, you have to put in controls to make sure that this risks and hazard doesn't come into being. And it doesn't also stop there. You have to manage your emergency preparedness. So you having your fire drills, right? You making sure that there is a procedure for emergency. You making sure that there's a training for first aid. You making sure that there are fire marshals. So fire marshals in here means that people are in charge of fighting fires. You making sure that they are first aiders. So in case of any emergency, they come and they make sure that there is first aid done on that victim. It's you managing your occupational health and safety. After you have placed controls in place, you have your emergency preparedness. It then comes to performance evaluation. You have to then monitor. You monitor your risks, you monitor your objectives, you measure your objectives. So if one objective is to make sure that there are no illnesses or fatalities in your company, you have to measure to make sure that whatever you set as an objective is being realized, right? So you have your resources. Okay, I'm making sure that there are no fatalities in my company. So I'm making sure that before they go and wear PPEs. PPEs are your helmet, your gloves, your just your shoes that they all goes on, right? So after that resource, you have someone making sure that even before they go and work on that, make an example, your company of construction. And you know that construction fatalities are very key. Fatalities can happen. So one hazard can be maybe the person falling from the high up or at height, the person can fall. So you make sure that even before the person goes, they have a scaffold that they'll climb up to, and they have helmets on. So in case they even fall down, their head is protected from injury. You have to make sure that, okay, let me measure my objective. My objective is to make sure that no person dies in my company. How would you measure this? Right? You have to have key factors or key indicators that you use to measure this objective. And then you also have to audit your system. So you audit all the requirements from clause 4 to clause 10 to make sure that whatever the standard as stated. Mr. Daniel, please, I think your mic is on. So if you could on mute or mute yourself. Right. So you audit your system, making sure that, okay, for clause 4, the requirement states that am I doing that? For clause 5, the requirement states this, am I doing that? This is where the auditing the system comes into being. So after you have audited it and you realize that, yes, I'm doing well, or whatever the OHS says, I'm doing it, you don't stay stagnant there. You drive continual improvement. You put in measures to make sure that every time your OHS is running, and you drive continual improvement. If you audit the system and you realize that no, there are things that I'm not doing well, right? There have been illnesses, right? There have been fatalities. You have to look at where you went wrong and take corrective actions. So you are doing well, you don't stand there, you drive continual improvement. You are not doing well, you take corrective actions to make sure that you are realizing your objectives. You are mitigating as well as improving upon your opportunities or realizing your opportunities as well. So these are the benefits of implementing the OHS, right? It would help you reduce workplace injuries, illnesses, and fatalities, right? It helps you identify hazard as well as manage hazards. It would also help you adhere to applicable health and safety laws and regulations. One example is me, I'm in Ghana. Our health and safety laws, one is fire certificate, right? The fire the national health, or sorry, the national fire insurance, what I don't even know the name for that, states that every company needs to have a fire extinguisher. So you having the OHS in place, make sure that you know that, okay, so this is the health and safety laws in my country, sorry, and this is what their requirements are, right? And this is how I'm going to adhere to each health and safety laws or regulations. And it also helps you to reduce the risks of legal penalties and liabilities. Assuming you are a construction company, right, or a highly hazardous company that fatalities can happen or injuries can happen, and you don't have this OHS in place. Once someone dies at your company, people would come and ask for what? Money. You have to pay penalties. Assuming you are a mining company and you don't have OHS in place, and there's an explosion, right, and someone dies. If the mining commission comes and they investigate and they realize that you are at fault, there are huge penalties to be paid. And you not only pay it to the mining commission, you have to pay it to the individual as well. And people will not even have trust in you. People will not want to work with you because they know that once they come and work in your organization, they will either die or they will have injuries. So that is why OHS is very important for every company. And then, just as I stated, that it would improve upon your reputation. Assuming that you're a company and always there are people getting injured or there are people dying because you don't have OHS in place, no one wants to work with you. No one would want to do business with you because they know that if they do business, they are at risk of what? Losing their business. And you can even be shut down. Because if you're a mining company and there are always injuries and fatalities, the mining commission will not allow you to operate. So these are some few benefits of the OHS. There are others that we'll take a look at the next slide. All right. So make sure that it fosters a safety culture through employee involvement in decision making. So people are then made to identify hazard, right? They are share their concerns to safety. So is this safety culture that's in company? It also lowers cost associated with accident. Just as I stated earlier, if someone is injured, you have to pay for the person's medical expenses. You have to compensate the person and make sure if that person takes you to court right now, because maybe you didn't make sure that there is a safety culture in your organization, you have to pay for legal fees. And one benefit is that you can also integrate it with your quality as well as environment standard. So whilst you are managing your environment and managing quality of your products or services, you are also managing how safely your workers or any other stakeholders work in your organization. And always there is a continuous improvement. So you don't limit the OHS as a standstill, but you always make sure that there are other things you do to improve upon the OHS. All right. So just as I stated, you can integrate the quality management system with the environment. And this alignment is based on the structure of high level structure. That's the Annex SL. And we'll take a look at what's the high level structure in the next slide. So the high level structure comprises of 10 clauses. The first one being scope, the second one being normative reference, terms and condition, context of the organization, leadership, planning, support, operation, performance evaluation, and improvement. And we'll take a look at what each of these mean in the next slide. All right, so just as I stated, the high-level structure comprises of 10 clause frameworks, right? That applies uniformly across all ISO management systems. So when you take quality, you have 10 clauses. When you take OHS, you have 10 clauses. When you take environment, you have 10 clauses. When you take information security management system, you have 10 clauses. And it's structured to reflect the plan, do, check, act cycle. All right. So what does this clause 1 mean? Right? It defines the boundaries and applicability of the OHS. So I have the standard here, and I would like us to look at what this scope is talking about. All right. So I want to go to where the scope is, right? So it just gives you an overview of what the OHS is and what it intends to achieve. Right? It gives you what the OHS is all about, and then what it intends to achieve. Right? Then we then go to the normative reference, right? So it gives you other standards that applies to the 45001, but currently when you look at the standard, there is no normative reference to reference the ISO 45001. Then the clause 3 talks about terms and definitions. So this terms and definition is going to give you definitions of key terms in the ISO 45001. So you understand what risk is, you understand what hazard is, even when we talk about a worker, who a worker is, and when we talk about interested parties, who are interested parties. So it doesn't just limit it to risk, hazard, work. It has a whole lot of terms and conditions. And if you have one of the standard, it gives you a clear definition according to ISO what these terms mean. Then we take a look at the context of the organization. This is where mostly companies start the implementation of the ISO 45000 from. The first 3 is not really in use, right? But from the clause 4 to 10 is where organizations start with the implementation of the ISO 45001. The context of the organization requires organization to understand the internal and external factors affecting the ability to achieve the intended outcome of the OHSM. Right? So before you implement it, you as an organization, you need to understand what your internal issues are. And mostly we use these internal issues to look at how it can affect the OHS. And we use SWOT analysis to be able to get these internal issues. So you look at what your strengths are, what your weaknesses are, what your opportunities are, and what your threats are. So your strengths can be that you have people in charge, competent people in charge to be able to manage the OHS. Your weakness is maybe you don't have PPs, or even though people are competent, they don't have any trainings. Opportunity is that maybe you can leverage on tools, right? AI tools to even help you fight, or to be able to help you manage your OHS. Your threat can be COVID, your threat can be pandemic. You get it? So the SWOT analysis is to give you an idea of what your strength is, what your weaknesses are, what opportunities you can leverage on, and what threats can affect your company with regards to occupational health and safety. And then the external factors, we use a pistol. The P for political, E for economical, S for social, T for technological, E for environment, and L for legal. So the internal is supposed to happen within your organization, but the external factors are things that can affect you but wouldn't be from your organization. So political, I'm giving an example. If there is political instability, right, you can't even work to even take to be able to manage your OHS. If right now there is an economic backslide of your country, you can't be able to manage your OHS. Right? If there is a coup d'etat right now, your company cannot really your company not really strive to even manage your OHS. So internal issues are to look at internally issues that can affect you achieving your OHS. And external factors are external factors that can affect you achieving the outcomes of your OHS. Then we come to another column that says that you have to emphasize identifying the needs and expectation of interested parties, such as employers, contractors, and regulatory bodies. So before you even put measures in place to be able to mitigate hazards and address risk, you should also know that, okay, what are the needs and expectations of my employees? One need and expectation of your employees to make sure that they work in a safe environment. So you have to for all look at what their needs are, and then you manage it based on what their needs are and also their expectations. Your expectations of your contractors or their needs is to make sure that they come and work in a safe environment. Your regulatory bodies, their expectations are that you adhere to whatever requirements they have stated. So if it is a fire certificate or a fire company, they expect that you have a fire extinguisher, and you also pay your taxes or your dues due to them. So these are the needs and expectations, and you have to identify them and document it even for attachment for your chest. Then we have 5, that is leadership and work, right? The clause 5 states that management need to be committed to the OHS. And when you check that it is to make sure that they so as they participate in the OHS, even out service, by making sure they so when they list out everything that management needs to do to comment. Without the top management, the HS cannot hold. If they don't give resources, people would be would then be in the company, right? Without they even looking at how the OHS is structured, the OHS cannot hold. And then you have to make sure that workers are involved in If that is so I'll give me tools that I can be able to work with to make sure that I am safe. And they need to participate in it. Then we come to this, that is planning. So the planning means that you have to identify opportunities government. So you have your opportunity like tools, like training, like things. What opportunities you create and your risk of event is a risk, right? Because people then not feel safe in the organization. And also you have to look at the requirements, just as I stated earlier on. And then the support. Support focuses on providing adequate resources, ensuring that the workers are competent. So if you company of construction and you work with machines, you have to even make sure that the person that is going to ride that machine is competent, right? They know how to use that machine even before they go near it. And you also have to foster effective communication. So awareness, making sure that people know hazard, people know what to do when it's only hazard, right? And also it states that you includes requirements for documented information to maintain and demonstrate compliance. So all these clauses we are talking about, you have to, if you identify risks, you just don't identify risks with words of mouth. You have to document it. So the clause 7, that is support, is stating that you have to have documented information for most of the things you identify. So if you are creating leadership commitment, or even you are establishing a policy, the policy has to be written so that if available, they can assess all your policies, all your intentions are. All right. So the clause states it's operations, right? So once you have planned for your risks, plans for objectives, plan for opportunities, you have to make sure that you put in controls. So if it is the risks you are planning for, after you have planned risks, so you realize that one risk is that there can be water spillage. And once there is water spillage and someone works on it, that person can fall. So the falling then becomes your risk, right? The water spillage is something that can happen. Then the slip, trips, and falls are your risk. If someone falls down, the person can get injured, right? So after that person gets injured, it can affect your productivity as well as affect certain elements of your organization. Because maybe if that person is supposed to work on something, that person would not be able to work on that. So after you have addressed your risks, assessed it, you have to put in controls. So one control thing where this place that put on one place is wet, so that one will know that okay, this place to pass and use another lane. So you putting in that structure that has the this place is wet, or that structure that has wet floor, is you putting controls to mitigate the person falling, or the person get the risk of the person getting injured. And the controls too is not just to manage risks, it's opportunities. Opportunities are things you are going to leverage on. So once you have been able to establish that, you should be able to make sure that you put things in place to realize that opportunity. So if opportunity is using tools, AI tools, to address your opportunity, to fight or to manage it, you have to make sure that you have AI tools in place to help you against risks, manage your hazards. Then the clause 9 is performance evaluation. Once you are done with you planning your objective, planning your risks and hazard, then you come to measure to state that, okay, I stated that I'll put this control in place. Let me check to realize that if this control is working. That the machine also measure even that internal. So then comes, okay, clause 4, you state your SWOT analysis, your pistol analysis. You said that leadership would be committed. What has leadership shown to show commitment? This is and it's used to assess the system's effectiveness. So if you conduct the internal audit, right, and you realize no, things management is not showing commitment, management has not given resources, that is where you take it as a non-conformity because you haven't really done what the requirement is, and it's conformities. So conformities means the requirement you haven't done it. And whatever the audit findings key at the standstill, or you don't just leave it at that. You look for continual improvement initiative to make sure that always your OHS system is running. So continual improvement, people are trained so that they know, okay, I'm supposed to do this, I'm not supposed to do this. When I see in an area that is restricted, I don't have to go there. When I see a place where that has electricity and it has been written that danger, don't come close, you don't have to go there. So you put in measures that is being improved. So by in continuing all right. So another structure or is the plan, do, check, and act. So the planning is for clause 4 to clause 6. So you plan for your internal and external issues. You plan for your interested parties, their needs and expectations. You plan for leadership commitment. You plan for worker participation and consultation. You plan for risks. You plan for opportunities. You plan for objectives. The do is that once you have planned for risks and opportunities, right? What are your risks? How are you going to mitigate those risks? That's where the do comes into play. So you putting in resources, putting people in charge to make sure that all this risk doesn't come into pass. So prevention is better than cure. That's what putting in charge. You making sure that people are aware of the health and safety procedures and processes. It's where the do comes into play. So the clause and the clause 8 is where the do comes into play. Then you have check. After you have planned, you have put things in place, you have put controls in place, you have put people in charge, you have resources. You have to then check that, okay, whatever I said, is it working well for me? So let's take one risk and then we can use this cycle to work on that. You have planned, okay, you check one risk is risk of fire, right? Or you work at a construction site and the risk is that people can fall from the high up or fall at height down and they'll be injured. You can put resources in place. One resource is that even the person that will go up has to be competent. You have to put scaffolds in place to make sure that they'll use the scaffold to be able to climb high up. You put controls in place. That is they'll wear anything that will protect them against them for even happens. Once you have been able to put resources, people in charge, controls in place, you have to check. So you monitor. Okay, was there any fatalities? Was there any injuries? So if maybe that person went up and the person fell down, then from it and now play. So this person fell down, but the helmet was to help put in that next time when the person goes up, the person doesn't fall. That's improvement comes. You have to lift up that all happened. So explanation do check and act. And it focuses on clauses. So clause 4, clause 5, for the plan, clause and A network went off a bit. Very sorry. I'm out we stop. So I'll share my screens again and then now at understand the occupational safety risks and opportunities. I've mentioned risks and opportunities. So what are risks and opportunities? So the risks are the likelihood of harm and injury arising from workplace hazard. So this can include physical, chemical, biological, ergonomic, or physiosocial hazards, right? So let us look at what this means. All right. So we have physical hazard. So hazard from machinery, noise, vibration, or force. Chemical hazard, exposure to toxic substance like gases or solvents. So you are working in an area that has petroleum gases, right? It can bring about chemical hazard. So infects viral you with economic extinction disease in officially designed. Instead of checking you're to always that economical hazard. Then you have psychosocial hazard. So even bullying for is that or a reverse means that once people are bullied or even right, it would even bring up down their morale. They wouldn't even want to work there. And in the goal of which has an yeah. So all these are of OHS from you can inhale some gases and health. Biological to health, like your health. And then we have psychosocial that can affect health, your mental health, and even affect you physically. Because once someone is being bullied, that person would be injured. So we have spoken about what the risks are. What are opportunities? So the opportunities are circumstances or conditions that enhance workplace health and safety, prevent harm, or improve organizational efficiency. So they have given us an example. So you implementing advanced safety technologies, you enhancing training program for employees, use training safety procedures to improve compliance and engagement. Oh, I heard that my network is bad. I'm so sorry about that. Kindly let me know whether you can hear me now. Kindly let me know whether you can hear me now.
We can hear you.
Okay. Thank you for that information.
We
So
can hear you.
okay. So for us to understand the health and safety, for us to understand the occupational health and safety and risks and opportunities, we first to come to the is for us to prevent injuries, for and treat and try to make sure that there is an improvement. So that is why we assess risks as well as opportunities. So looking at risks, you have to look at what can affect your employees as well to mitigate those. And opportunities are things that you can leverage on, like trainings, like safety technologies. So you have machines instead of people use machines to go up. Instead of using manual to make sure that what people are going to get out of those things or even out of the machine.
All right, everyone, please, we implore you to stay on the call as our trainer has some network issue, but she will be back really soon. Thank you so much.
Sorry about that again. My network is quite bad today. I'm sorry. Let me share my screen again. All right. So these are the reasons why we have to assess risks as well as assess opportunities. All right. So how are you going to assess or identify risks and assess opportunities? For risk assessment, first you have to identify the hazard. So you can use workplace inspections, audits, employee feedback to identify hazard. So you have to encourage the employees to speak up when they see hazards, right? And the hazard is related to routine or non-routine activities. So routine activities are things that they do all over again. So if you're a plumber and you always like to repair pipes, always, that is the Non-routine means that something they don't normally do every day in their workplace. Emergencies and external factor like weather. And then once you identify these hazards, you assess its risk, right? So you let's take an example. You identify the hazard of maybe toxic chemicals entering into people's noses. You assess its risks. You assessing its risks means that you have to assess the likelihood of occurrence and the severity of consequence. So you realize that one hazard is that you have a gas in your company and the gas is very toxic. The likelihood of it entering into your nose, right? And its impact. Once it goes into your nose, what are the impacts or what are the consequences? So once you multiply the likelihood and the impact is how you come about or how you analyze your risk, right? And you use a risk matrix, low, medium, high, to prioritize this risk. So if you realize that, okay, its likelihood of it entering into your nose is high, and if it enters into your nose, the impact is high, definitely it would be a high risk. Because then you know that, okay, this thing can, where it has been put or where it has been seated, the likelihood of it going into my system is high. And once it goes into my system, its impact is also high. Then it's a high risk. So which means that we have to put in control to make sure that that's the low, medium, and high. All right. So once you analyze that risk and realize that, okay, that risk is high, you have to put in controls, right? And we can use the from A to E to assess or to evaluate and address this risk. Eliminate hazard means that you remove the hazard from there at all. So you if there is a toxic chemical, you have to remove it from there. Substitute hazardous materials or processes. So if it is a highly hazardous chemical, you put in a less hazardous chemical there, but it would work at the same as the hazardous material or the hazardous gas. So you use engineering controls. So instead of you going near the hazardous gas, you wear maybe a safety a safety nose mask that would make sure that that gas doesn't enter into your nose. Or you use apply administrative control. So people will be trained that, okay, if you are nearing this gas, you have to give maybe a maximum of 5 millimeters or even 5 miles, or you don't even have to be there. Or you put in signage to say that, okay, this place is restricted, so no one should come near. Or you even apply or provide protective personal protective equipment, that's the PPE. So that person has to wear that nose mask, that person has to wear maybe goggles, that person has to wear maybe hand gloves before they even get nearer to that hazardous gas. So these are how you evaluate and address this risk. You can either use from A or E, or a combination of both, or a combination of two or more. And after you evaluate and address those risks, you have to identify and leverage opportunities. So what are other opportunities you can use to enhance your OHS? You review workplace strengths and emerging technologies. So if it's machines that should help people to be able to do the work is effectively, you can use that so that people will not come under the risks of the any risks at all associated with whatever they are doing. Monitor feedbacks from audits, inspections, and employee suggestions. So your person or your OHS manager has to do inspections to even look at what kinds of hazard do workers face every day. You can also monitor feedback from audit. So once your audit has been done and you realize that you are falling short in any requirement, you have to then look at, okay, what things can I put in place to make sure that this thing doesn't happen again? That is how you are leveraging upon opportunities. And also employee suggestions. You realize that in the clause 5, it stated that workers needs to be involved as well as participate in the OHS. So you have to make sure that you ask your employees what their suggestions are, right? So all the decisions is on what top management says in OHS, but workers are highly involved in it. You also have to promote innovation, right? So you certain safety procedures you can either, since you are using it as you are using manual processes to be able to improve upon your safety, you can digitalize it. So just as I stated, you are using machine to manually lift out things in your organization. Is where you promote innovation in safety practices, or you adopt digitalized systems. Is where you are promoting innovation in safety practices. All right. So another one is understanding the health and safety risks and opportunities. So tools and techniques that you can use to assess the risks and opportunities. You can use the job safety analysis, right? So you can give your employees, right, a sheet of paper that has steps broken down to identify and mitigate risk. So the job safety analysis, if they are going to do a certain job, they have to list the number of hazard in that job, look at things that they need to do to mitigate that risk even before they work on that job. So that is the job safety analysis. That's where the 8 names come from. You have to do SWOT analysis. So here is where I'm talking about is for you to know what your internal issues are. You have to look at the organizational strength, its weakness, opportunity, and threat to identify improvement areas in the OHS. So if you realize that your weakness is that you don't have tools in place to protect people from safety risks and hazard, you have to then make sure that there are tools in place. If you know that your strength is that you have capable people, you don't leave it at that, but make sure that there is continuous training to make sure that they are still competent to be able to manage the OHS. Opportunities, we already spoke about opportunities. Threats are things that can affect your OHS. So you don't limit it, or you don't keep it at that, but you put in measures to make sure that that threat never happens. So the SWOT analysis is supposed to guide you for you to know that, okay, these are my strengths, these are my weaknesses, these are opportunities I can leverage on, and these threats can affect me. So these are the controls I'll put in place so that that threat never happens. You need to have a hazard identification and risk assessment. So once you do the job safety analysis and you look at, okay, these are the risks that I have identified, and these are how I'm going to mitigate those risks. You have to also have a systematic approach to identify. So you have to have a risk assessment methodology, so that anyone that picks up that document know that, okay, this is how you approach your risk. This is how you are going to assess those associated risks and plan controls to mitigate. And we have benchmarking.
Sorry, Elizabeth.
Okay.
The time is actually up, but you can
Okay.
just take a few minutes to round up, please. Thank you.
Okay. So you can benchmark. So you can compare what you have against other safety industry standards. And you can also raise registers. So once you identify those risks, you don't just keep it, but you have to make sure that they are documented. That's where the clause 7 documentation comes into play. So this is how you address your safety risks and opportunities. All right. So we have spoken about PDCA, we have spoken about risk. So I'm trying to look at all right. So the last thing I'll talk about is you making sure that you are compliant with legal and other requirements. Right. So the OHS expects that all safety laws and regulations, you comply to them. So you have to even identify what your safety laws and regulations are, even before you know what they expect of you, and then comply with them. And you have to monitor it to make sure that you are always achieving that. Right? You have to always monitor it. So if it is one safety law is that you're supposed to pay your tax, you have to make sure that every month or however you have decided to pay your tax, you have to do it. You have to monitor it to make sure that you are paying your tax. Because once you don't pay your tax, the government will come for you, and you wouldn't be able to operate. If you are supposed to have a fire certificate or a fire extinguisher in your company and you don't do it, or that you have done it, but the next year that fire certificate or has expired, they would come around and then make sure that they will either give you penalties or you have to pay a huge sum of money because you are putting people at risk. So the OHS expect that you identify all your legal requirements and make sure that you look at the requirements and then adhere to whatever they have stated. And once you have been able to adhere to whatever they have stated, you have to monitor to make sure that you are continually complying to whatever requirements they have stated. So this is the importance of being in compliance with legal and other requirements. So the slide is up to 78. It contains more things that we have to look at, but time would not really permit us to look at everything. So I'd like to bring the class to a halt now, and I would like to know if anyone has any question or anything that they didn't really get so that I can provide more context on that. Thank you. All right.
Thank you so much, Elizabeth. That was really,
Okay.
really. So please let's appreciate Elizabeth in the chat
Okay,
box.
someone has
Okay.
raised his or her hand. Yeah.
Okay, Ismail, please go ahead to unmute and speak.
Hello, good day, everyone.
Yes, good day.
Yeah, thank you very much for the presentation. It's actually engaging. My question is, you mentioned that when we are implementing occupational health and safety, we can
Yes.
integrate with QMS.
Yes.
From previous class, I've been hearing of implementing, integrating QMS with other standards. So how is
Yes.
it going to, at what point are you going to introduce it? You understand?
Okay.
At what point of the control you are going to introduce the QMS?
Okay.
That's my question.
So,
Thank you.
so you see that the OHS has clauses, right, from clause 4 to 10. Even though it's from clause 1 to 10, the first three we don't really implement it. For the clause 4 to 10 spells out requirements that we need to do, right? The QMS has the same clause 4 to 10. And whatever the clause 4 in OHS is, that's the context of the organization. The QMS has the same context of the organization. So you integrating it, you get one document instead of two separate documents, as in you having OHS clause 4 and you having QMS clause 4. Clause 5 is leadership and commitment. Under that leadership and commitment, there are sub-clauses. So that the clause 5.1 is leadership, clause 5.2 is policy, clause 5.3 is roles and responsibilities. QMS also has the same thing, as in clause 5.1 is leadership, clause 5.2 is policy, clause 5.3 is roles and responsibilities. So since they are the same, you can have one single document and implement it separately, right? Rather than having two separate documents. Because whatever the QMS states, that's what the OHS is also stating. But there are also differences in some of them, like the clause 8. The clause 8 are both operations, but what is under the clause 8.1 is different from what is under the clause 8.1 for OHS. What is under the clause 8.1 for EMS, that's environmental management system, is separate from whatever has been mentioned in OHS. But we can integrate from clause 4, clause 5, clause 6, clause 7, clause 9, and clause 10. But the 8 will be different. So that's where the integration comes into play. Please, I hope that your question has been answered.
Yes, thank you very much. About you
All
have
right.
that operation is where the difference comes in. So I gathered that. Thank you.
Okay. All right. So please, someone says, can you share the standard with us? Okay, that's fine. Let me try and share that. Let me stop sharing my screen and then we can. Okay. So I'm going to share that with you. I hope anyone doesn't have any other question again that you need clarification, or you didn't get anything and you want me to explain further. Okay, please go ahead.
Yeah, thank you. So I
Okay.
want to know, in carrying out the risk assessment,
Mm-hmm.
so is there a template to form? Does the standard come with a template to follow to carry out the risk assessment? And then how is
Okay.
it possible for you to quantify, like measuring the impact? So how is it possible to quantify to determine which of the risk is severe, like or the hazard, which of it is severe? So how do you quantify? Is there a standard for that also?
Yes, so there is a standard called ISO 31,000, that is for risk management, that spells out on how you or gives a guideline on how you should be able to assess risk, right? So it's called 31,000, that is risk management. So the ISO for risk management, or risk managing risk. And for you to quantify it would depend on your methodology. So if you have a risk assessment process or procedure, and you have until how you want to even assess your risks, that should give you a guideline of how you want to quantify your severity. So some people, they use the 5x5. That is 1 for low, likely, then 2 for maybe it can happen, then 3 for moderate, which means that it would likely or not likely happen. 4 is likely, and then 5 is highly likely. So depending on your methodology, it would be based on how you want to assess your risk. But we have a guideline for that. That is the ISO 31,000. I don't have that standard, but you can research and then get access to that standard. Please, I hope your question has been answered, or you have other question on top that you want clarification on.
All right, thank you so much, Elizabeth. We are eating into our break right now.
Okay.
So thank you so much. Let's appreciate Elizabeth in the chat box. Thank you so much. Thank you so much. While we're on our break, there can be engagements in the chat box. So Elizabeth, please, if you have some free time, you can check the messages in the chat box and just reply on there. Thank you so much. So right now we'll be heading for our break and we'll be converging back by 12 noon West African time. Thank you so much, everybody.